All right. Hello, everyone. My name is Cassie Munoz. I'm with the Center for Educational Outreach at Michigan Tech. Welcome to Tomorrow's Talent Series. So today's Tomorrow's Talent Series is all about medical laboratory science, and we are joined by Claire Danielson. Claire, do you want to introduce yourself?
Sure. My name is Claire Danielson, like she said, and I am a medical laboratory scientist that works at Michigan Tech in the Medical Laboratory Science Department. I teach several of the MLS courses, as well as helping our students get placed at practicums, which is essentially an internship that you would do before you become board certified. I did work in a lab for several years before I came back into education.
Awesome. Thank you, Claire. So Tomorrow's Talent Series is all about showcasing in-demand careers through virtual job shadowing videos, Q&A events like these, and as well as hands-on activities that we have on the website. So, whoops. The series is brought to you by a number of different partners, including Upper Peninsula Michigan Works, the MySTEM Network, Go Givic, Bay College, and Career Tech Educators, and of course, Michigan Tech. In case you haven't seen the video that Claire starred in, that is available on the Tomorrow's Talent website as well. Check it out. She goes kind of in depth about all the different equipment that you will see in the lab. So today, Claire, we've gotten certainly a lot of questions about the video, and we'd like to learn a little bit more about what we may not have seen from what you've shown us.
Sure.
And for those of our attendees who are live right now, if you have any questions, you can use the Q&A feature right at the bottom of your screen there. Looks a little bit like this, or you'll see a Q&A there. So if you chat those questions in, we can feed them to Claire for you. All right. Let's see here. Oops, just one moment. Okay, so Claire, we've seen the video, but can you very simply say, what does it mean to be a medical laboratory scientist? What does your job really entail on a day-to-day basis?
Sure. So on a day-to-day basis, a medical lab scientist is basically the person that runs all of the laboratory tests that give the information to a doctor or a nurse practitioner to help tell them, how the patient's health is overall. So whenever you go in to get your blood drawn or give a urine sample, or you get, a wound swab, or you have to get, some type of a skin tag or something removed, we run all of the tests that give the doctors the information that says basically in a nutshell whether you're healthy or not.
Awesome. Obviously, that's pretty important work.
Yeah.
So what aspects of this field made you want to pursue a career in it?
This is a great question. When I was in high school, I kind of always knew that I wanted to be in the medical field, but I didn't necessarily want to be a doctor or a nurse. And I knew that there had to have been obviously other things that went on in the hospital. So I did a little bit of research, and actually I went to high school locally, and we did, I can't remember, it was a high school visit. So we actually visited Michigan Tech, and I learned about medical lab science through attending a high school visit, and learned all about it through Karen, Faye, and Alice Solden. They were the old program directors at the time. And they basically said, we're the brains behind, all those numbers that your doctor is feeding you. We're the ones that are figuring those numbers out. 70% of a patient's diagnosis actually comes from lab results.
Wow.
So once I heard that, I just, I just became very interested and knew that that was something that I wanted to do, being a part of, diagnosing a patient, but not necessarily working directly with patients.
Yeah, absolutely. I think a lot of us don't realize how much actually goes on behind the scenes. So some people think maybe they couldn't work in healthcare because they're not sure they want to work directly with patients, but the work you do is critical for making that care happen.
Absolutely.
So what type of education or training do you need to become a medical laboratory scientist?
Sure. So typically, I guess there is what's called a medical laboratory technician and a medical laboratory technologist. And a technician is a 2-year program, which I won't really focus on that today because Michigan Tech only offers the 4-year, which is the technologist. but just know that there is a 2-year option out there. It's an MLT versus an MT. But to become an MT, you have to complete 4 years of an undergraduate degree in some form, depending on where you go. And then in addition to that, you have to complete what is called a clinical practicum. It's very similar to an internship, that an engineer might complete or something like that. And the time ranges from anywhere between 6 months and a year, depending on where you complete it. There are different time criteria depending on where you go. And essentially what that does is gives you more clinical hands-on experience in an actual hospital setting, because a lot of the, schools and universities that you will go to train for this essentially is not going to have all of that equipment. And ASCP, the American Society of Clinical Pathology, is the society that essentially gives you your credentials or your certification. And they require that you get X amount of time or training in a hospital before you can take that national registry and become certified. So in a nutshell, it's approximately 4 years of schooling with a 6-month internship.
Wow, awesome. Now in the video, you showed us a lot of different types of equipment that you use to run different samples. Does it take additional training to be able to use those? I mean, are you always continuing to learn more on the job as, different technologies become available to you?
Sure, yeah. So depending on where you work, you're going to encounter a plethora of different analyzers. There's all kinds of different ones. So depending on where you work, you will get hands-on training for those specific analyzers. They all have the same background, essentially. They all do the same thing, but the maintenance, the quality control, those types of things that you do on a day-to-day basis are going to be different from analyzer to analyzer. Some places or networks will have the same instrumentation. For example, if you work for the VA hospital system, any VA hospital that you work for, they use the same equipment. So it's kind of nice if you go from hospital to hospital, you already know the equipment. Or if you were in the Aspirus system, for example, if you worked at Aspirus QAnon, they have the same machinery and equipment as Aspirus WASA. So depending on where you go, if you stay in the system, you'll kind of use that same equipment. But if you bounce around, you're going to have to learn different things. But it's not overwhelming and you catch on quickly.
Sure. Okay. So, back to some of the different equipment that you used in the video. Do most medical laboratory scientists just specialize in like one or two of those, or does everybody sort of learn how to use every single machine? Do you float back and forth, I guess, or do you specialize in some of the different areas that are in the lab?
That is a great question. So this really depends on the size of the hospital that you work at. So if you work at a smaller hospital, like in the Houghton, Baraga County area, you are typically what's going to be called a generalist. And a generalist is somebody that floats between all the different departments, because being a smaller hospital, you have to be able to work in blood bank, come over to chemistry, work in hematology. You might even have to do some of the blood draws if they don't have phlebotomists. So if you are in a more rural hospital setting, you are going to work in all of the departments most of the time. Sometimes you may specialize in just blood bank or microbiology. Those two departments kind of tend to be on their own. But otherwise, you usually work all of them. Whereas if you work at a bigger hospital system, for example, I did my practicum at Hennepin County Medical Center in Minneapolis, and that's a huge level 1 trauma center. And most people that work there are just in one department, so they just work in chemistry, they just work in hematology, they just work in microbiology. So depending on the size of the hospital will depend on whether or not you are what's called the quote unquote generalist, or if you specialize in an area.
Sure. Are there other differences between a rural hospital lab and a more urban hospital lab?
There's all kinds of differences, but some of the main ones is really, in the rural lab, like I said, you're more likely to be a generalist. So you're going to work in all areas and be proficient in everything. You might not be, as advanced in some departments as you would in a larger hospital. You might not hone in on really specific testing because it's a smaller hospital. Whereas if you were to work in a more urban hospital, you might do a wider variety of tests. Like a lot of the tests that are done here, there might be some that we just don't do in-house because it's not cost effective. So we would send those out to what are called reference hospitals. So for, example, UP Health Systems Marquette is a big reference hospital for a lot of the hospitals in the UP. So yeah, if you work in a more urban hospital, you're going to see a wider variety of testing, and you're going to be kind of more specific to one area.
Sure. All right, well, what are some of the most common tests that the lab processes from your experience?
Sure. The most common tests that we see on a day-to-day basis for most people are what's called the CMP, or a complete metabolic panel or profile. And that's just looking at your electrolytes, how your liver is functioning, your kidneys. You get a list about this long of, it's kind of like your general, how are you doing, right? The next one is what's called a CBC, or a complete blood count. And that looks at your red blood cell indices to see whether, if you may be anemic, how your hemoglobin is doing. A CMP and a CBC are very common on pretty much anybody that walks into the hospital. If you're getting a physical, or, you walk into the ER with some type of ailment. Another really common one is a urinalysis. Just being able to look at somebody's urine sample, you can tell a lot about a patient's health. So we do those very commonly. Liver studies, looking at people's liver, a coagulation studies, looking at somebody's ProTime or PTT. That tends to be common, especially if people are on any type of blood thinners or anticoagulants like that. It really just depends on the person's, health history too. An A1C is another common one for people that may be diabetic. That looks at your blood sugar history over a 3-month time period. But I would say the top 3 would be a CMP, a CBC, and a urinalysis.
Okay, got it. Now, sometimes we know that you go to a doctor and they, want to do a test, and you can't eat for a certain time period prior to the test being taken. Can you tell us why that is the case?
Sure. So the most common one that they don't want you to eat for is that CMP that I told you about. And that is because it contains a glucose. And glucose is basically just looking at your sugar. And if you eat any type of food, whether it's a sandwich or a banana, it's going to have some type of sugar in it that's going to spike your blood sugar. So it's going to falsely elevate that glucose level. So they want you to be fasting so that it's looking at your glucose, without any food affecting those results. Some other tests that they might have you fast for, or not necessarily fast, but, refrain from taking a certain type of medication. Because if you take that medication right before you come in, and then we draw you for that certain level of that medication, it can be falsely elevated because you just took that.
Sure.
So we want to just look at it at a stable level and see what is your glucose, right when you wake up in the morning or something, not after you've had a bowl of cereal and a banana.
Makes sense. So on that note, are lab results typically very accurate?
Yes, absolutely. And I tell this to people all the time, that no matter where you go to get your blood work done, if you get a CBC done in Calumet, or you get a CBC done in Minneapolis or Texas, they're going to be 99.9% the same. Unless you're in Colorado, because of the elevation, your hemoglobin tends to be a little higher there, but it's adjusted.
Interesting.
Yeah. The hemoglobin levels in Colorado, Denver specifically, are higher than they are here, because at a higher elevation, your body produces more oxygen, so your hemoglobin goes up. So with that aside, if you get a lab result done anywhere in the United States, it's going to be very, very similar. And that is because all of the hospitals that put out these lab results, they complete proficiency testing. They go through CAP surveys, and that basically is to verify that the results that they're putting out are accurate. So these CAP surveys are sent blindly to all of these laboratories. And if they do not fall within a very tight range, they can essentially have to take that test off of their menu because they're not putting out accurate results.
Wow.
So you can be rest assured that any test result that you get goes through quality control. Quality control is run every day. Hospitals have to go through these surveys. So the test results are very accurate. Obviously, the interactions that you have with doctors are going to be different from hospital to hospital, but if you get a CBC here or in Green Bay, it should be very, very similar.
Wow, I didn't know that. Next question, obviously we are living in unprecedented times and in the middle of a pandemic, and lab testing, is that something that you do currently for COVID-19?
Yes. Hold on one second. I seem to have lost our screen.
Oh no.
Can you still?
We can still see you.
Okay, then that's fine. I just can't see our screen, no worries. Yeah, so medical laboratory scientists are the ones who are running all of the COVID tests. So as much as we hear about our frontline workers, the doctors and the nurses who are incredible and who have been doing incredible work, the medical lab scientists are the ones that are actually performing all of the testing.
Wow. So it's quite a time to be a medical laboratory science.
Yes, and a lot of the medical laboratory scientists are actually retiring right now because it's a lot of the baby boomer generation. And there was kind of a gap where people didn't really go into the field. So now with all of them retiring and all of this COVID testing, there are all kinds of sign-on bonuses and desperate hospitals looking to hire medical lab scientists because, like I said, that gap year, there just aren't enough of us to work in the hospitals. And the job outlook is 100%.
Wow, that's awesome. And of course, that's the whole point of the Tomorrow's Talent Series program, is that we're trying to highlight these in-demand careers. So that's really encouraging. All right, in the video, we were shown the phlebotomy room. You said that sometimes med lab scientists do take some of the samples, especially in a more rural hospital or where there may not be a phlebotomist available. Is that something that you had to go through additional training to be able to do?
No, not necessarily. So in my clinical practicum or my internship, depending on where you go, you will spend a certain amount of time performing phlebotomy. So some places have you do it for a couple of weeks, some have you do it throughout the whole entire time. You might draw every morning and do like the morning rounds. It just depends on where you go, but you really just learn on the job to perform that. And honestly, I would say 9 out of 10 times you will not be performing phlebotomy. The only time that you really will is if you are working maybe a midnight or an afternoon shift where the phlebotomists aren't there at a more rural hospital or something. But any hospital that I've worked at until I came to the UP, I never had to draw blood. So once I came back here is when I had to sharpen up my phlebotomy skills. And And Michigan Tech actually does have a phlebotomy class. So it's a semester-long course where we teach our students how to draw so that you're not, blindly going into it. So you will get some experience here too.
Good. I'm sure that's appreciated by the patients as well.
Yeah, absolutely.
So what are some of your favorite aspects of your job?
This is a great question. My favorite aspect, honestly, is the variety. I'm never bored. You never do the same thing. You're always troubleshooting. You may interact with patients a little bit, so you get to see a little bit of the patient side, but you're not directly involved with them. You're fixing machines. You're looking at different samples. You're looking at different red blood cell, looking under the slide or under the microscope at all kinds of different slides. I'm never bored. You don't come in and do the same thing every day because people have all kinds of different things that are wrong with them. So really, my favorite aspect is just the variety of things that you see. And just the sense of feeling, like that you were a part of healing someone or somebody's health journey, making sure that their lab results are accurate, making, even though you don't always see the patient, you always remember that somebody is behind that tube of blood or something, so just kind of having those connections, it makes you feel good even though you're not really interacting directly with that patient.
Yeah, absolutely. Now you said that you've been in the field for a number of years. So has the profession changed at all since you started? For example, are there new technologies that have been introduced?
Yeah, I would say it's always changing. Technology is always advancing. So things are always, we like to say, getting better, whether or not people think that or not. I would say the one department that has changed the most would be molecular biology. That's kind of like microbiology's big sister. So molecular has advanced a lot. I would say, things, for example, we would do stool cultures on agar plates and incubate them for 24 hours, perform a series of biochemical tests. The doctor might have to wait, 24 to 48 hours before they would get a result. Where now a lot of the testing is moving more towards PCR, polymerase chain reaction, and that's how our COVID tests are being run, and that lets the doctor get results in just hours to minutes. So a lot of things in molecular and micro have gone to PCR, and the big thing is that doctors are getting results quicker, which is a good thing. I mean, that's the goal, is to reduce turnaround time so that patients get results sooner.
Yeah, definitely. All right. Another question here. What are some of the soft skills that a medical laboratory scientist needs to be successful?
Sure, this is a really great question. I actually cover this in my 0600 class with my students. But I would say the biggest one, or one of the biggest ones, is your communication skills. Being able to communicate to doctors, nurses, all the different people that you interact with in the hospital are key, especially when you're talking on the phone. If you're calling critical results, you have to be professional and be able to communicate those, numbers to the doctor so that, they don't make a wrong diagnosis or something. So communication is huge. Professionalism is huge because you will be interacting with patients, so making sure that you are friendly. These people that normally come to the doctor, for the most part, it's because they are unwell or unhealthy. So, just being considerate, kind, compassionate to these people because they're sick, so just kind of keeping that in mind. I would also say time management is huge. A lot of times you'll have to be multitasking. You might put a sample on the hematology analyzer, and then you might have to run over and go do a urinalysis while you throw the chemistry sample on. And then once that chemistry sample gets done, you have to go and result those out quickly because that person is in the ER. So you have to be really good at managing your time because you're always going to be multitasking in the lab, for sure.
That's good information. Is there any advice that you have for students who may be interested in going into this field?
Yeah, I guess definitely reach out to people that are in the field, or if you're interested in a school, go to their website, email somebody like me or Dr. Rob Larson, who is our program director, and just ask questions, and because it is something that not a lot of people know about. So I think really just kind of asking questions and informing yourself as much as possible before you go into the program, so that you can make an informed decision of whether or not it is a good fit for you. We get a ton of students that come over from biomedical engineering that say, biomedical engineering, I heard the word medical in there, so I thought it was going to be a lot more medical, but really it was a lot more math than I wanted it to be. Or so then once they hear about our program, they're like, this is what I wanted to do. They don't necessarily know that it even really existed. So just asking questions, attending things like this, reaching out to guidance counselors to kind of find out what it is, because I really think we are this hidden little degree at Michigan Tech that people don't really find out until they want to switch majors, and then they say, oh, I didn't even know this was a thing.
Yeah. Awesome. And that happens a lot. I think when students start on a path, sometimes they just go with what they know. And of course, our goal with the Tomorrow's Talent Series program is to expose students to many different types of pathways so that they can tailor them to what their interests are and really have a good feeling of what opportunities are out there. All right, well, it looks like we're just about out of time here. So Claire, I want to thank you again for joining us today, and also for making that incredible and really educational video about the behind the scenes of your work. So we do feature a new theme every month for our participants who are with us now. So stay tuned for more videos and more Q&As, which will be on our website. Next month's theme is technology fields, really broadly defined. So you might be surprised at some of the videos that we have next month. And then certainly a huge thank you to all of our different partners who make the Tomorrow's Talent series possible. Here is more information about where you can find those videos. You can also find us on Instagram, and you can always search the hashtag too. If you share something with the hashtag, you can also win some swag. So with that, thank you so much to all who have joined us this afternoon. This recording will be up very soon. And thank you again, Claire, for your time.
You're so welcome. Thank you for having me.
Sure. Thank you.